Let's talk about 6-week checkup. Why are we waiting this long to even think about recovery?
Yeah, that's a good question. So from my understanding, the 6 weeks is a mark where the cervix should be closed and the uterus should be an appropriate size again. So those are some of the things that the physician will look at, or the midwife, when you go back at the 6 weeks. The idea that recovery starts then likely stems from, one, knowing that it's reasonable to say that you shouldn't jump back to exercise or any kind of fitness routine right away. So what's not right away? What's the appropriate amount of time? From a musculoskeletal point of view, that 6 to 8 week mark is a common one for sprains, strains, bone breaking. So it's a common healing marker. The concern with doing nothing for 6 weeks and then being told you're cleared to do whatever is a similar concern like we talked about with the first trimester to the second trimester. If you do nothing for 6 weeks and you're really thinking, oh, I better rest or else I'll hurt myself. And then at 6 weeks, you're like, I'm cleared. Here we go. Pilates, CrossFit. I'm going to run 2 miles and see how I feel. Then we haven't taken those first 5-6 steps to bridge the gap from where you are after resting, because you can lose up to 10%, 12% of your muscle mass in 1 week of bed rest. So if you go 6 weeks of bed rest or minimal activity, and then you jump into high-level activity, you are creating a perfect environment for sprains, strains, pelvic floor issues, incontinence, prolapse. All of those categories will shoot way up if you don't know to respect that bridge. Mm-hmm. And that bridge is rehab. That's us. That's who we are. That's what we do. We break down the steps from where you're at to where you want to be.
So what would you do differently? What would be the advice of if you would have it your way as a physical therapist to be okay, women, after birth, this is the plan. Obviously, I'm sure you're going to be it depends, give me the attorney answer. But in general. I can
neither claim nor deny. Yes.
Disclaimer, 20 million little words of it.
Okay. I have not assessed your body, so I don't really know. Yeah.
But in general, what would you say would be an ideal, after birth plan?
Yeah,
considering.
Yeah. I mean, ideal would be to see an expert physical therapist within the first 2 weeks. Get your body assessed from head to toe. Are your pelvic bones aligned? How's your spine doing? How are your soft tissues? And we don't strain the system, so no heavy weights, no high reps, but you can absolutely perform things that look and sound like exercise before that 6 weeks. I mean, even just engaging your core, contracting your pelvic floor, stretching your legs, treating your neck, your upper back, your arms, because you're just so holding, feeding, walking, burping. I mean, we don't get rest in that first 6 weeks. So to treat those tissues and help them come out of the chronic patterns and slowly transition into more alignment, more connection, more strength, that's really all you need. It's nothing massively groundbreaking. It's really just staying connected to your muscles at the level they can tolerate progressively.
Beautiful. What is an ideal time dedicated to physical therapy that is optimal for a woman in postpartum?
Yeah, so for postpartum recovery, we found physical therapists see that first year of postpartum as being worthy of having intervention.
What is the appropriate time per session or what?
Yep. So even from there, so we usually work with patients for a full hour, one-on-one.
Wow.
Yeah. So they get a lot of head to toe treatment. It's soft tissue work, bone alignment, strengthening, stretching, postural education, teaching them how to move their body and maximally. Last week I did a postpartum session. We did all the body work. She had prolapse during pregnancy and she's likely still has it, though we didn't check yet. Her baby was almost 3 weeks, but her toddler is 2. And her toddler wanted her to put him down at night, right? That's all he knows. Mom rocks me at night and she puts me to bed. So she asked me, do you think I can do that now? Like, the baby's almost 3 weeks. I'm feeling a little bit better. And I was like, let's go. So we went upstairs. She sat in the rocker chair. She held the toddler. And of course, he's pissed. He's like, I'm not freaking going to bed right now. She's like, no, we're rehearsing. Chill. And so I coached her through. I'm like, show me how you hold him. How would you stand up? And I'm like, scooch to the edge, lean forward, lift on your pelvic floor, hug the belly towards your heart. Now stand up. And she was like, he feels lighter. Like, I can do this. Walk to the crib, show me how you lean over. Wait, okay, maybe we'll put a little step here. Maybe we'll do that. So you modify the environment. But I left and she's feeling confident putting her toddler down.
Aww.
You know? Like, that's huge.
You know what I realized, and it might be like, oh, this is so stupid, Diana, like, for real. But like, when people have accidents, like they go on a bicycle and they hit themselves and like they have trauma because they did that, automatically physical therapy.
Mm-hmm. Yeah.
You have birth, like the whole thing is fully traumatic, and like physical therapy is not even mentioned in the conversation.
I know.
What's wrong with us?
What is that? What is that? I mean, truthfully, I worked at the hospital for 11 years. I saw how many surgeries and conditions. It was an automatic PT referral. Automatic. You had your knee replaced, hip replaced, a stroke, a heart attack. They're just like, you had a change in your body. Even if a patient went into the hospital because they had pneumonia and they were so sick. But if they recovered from pneumonia while in the hospital, before they could leave, the social worker would screen them and say, oh, you can't safely get to the bathroom from your bed because you're so weak. Physical therapy.
But you have a baby, like you tear down like I don't know how many things, like oh no, go home, you'll be fine. Women have been doing this for centuries.
Like, they weren't even being screened. I mean, it is better now. I see in the Facebook groups that I'm in and on different other women's health PTs that I follow on Instagram that they have started programs in their local hospital and that they're regularly screening, even just with a little questionnaire, women who have had C-sections. So it's getting better, but
yeah, we still need more awareness.
Even when I was in the hospital 6 years ago with my daughter, I did not have the attention that I needed. I mean, I really had a hard time getting from the bed to the bathroom. And they not only did they not ask, but when I showed them signs, they were like, other women do it. I feel like you should walk.
Oh, God.
Oh, thanks. I'm all of a sudden better.
Got it. Other women do it.
Yeah.
Other people get into car accidents. They're
yes.
like,
yeah. I usually walk away from an accident of that speed. Great. Good to know. Thanks.
Oh, my God.
Yeah.
Help.
I know.